Hello everyone, my name is Qianhe Zhou. I am a junior student from New York University in the United States. And the paper I will be presenting today is titled Research on the Effectiveness and the Efficacy of Music Therapy Methods in the Treatment of Depression. My presentation will be divided into 6 parts, and I will briefly go through my abstract, research background, research content, research result, conclusion, and reference. The first part is my abstract. Due to the side effect or unsuitability of traditional therapists for some patient groups, there is a need for a new form of depression treatment. Therefore, society has turned its attention to music therapy, which has been shown to have significant effects in the treatment of mental illness and depression. This paper categorized music therapy method into active and passive music therapy methods for separate exploration and comparisons. Active music therapy methods are further divided into improvisation, creative, and recreative. The effectiveness of passive music therapy methods in the treatment of depression mainly lie in the improving patient sleep and promotes beneficial emotions. The effectiveness of active music therapy methods are mainly including the improvement of physical pain, the increase of positive emotions, the relief of anxiety, and the increase of social interaction abilities. The receptive therapy group reached the peak of the treatment effect faster, but the active therapy groups has a higher peak effect. The second part is the research background. In recent years, with the constant increase of life pressure, depression has become a serious social problem, especially after the COVID-19 pandemic. The rate of depression has increased even faster. According to WHO data, the COVID-19 pandemic has caused a 25% increase in global anxiety and depression rates. Society urgently needs a more effective treatment method for depression. Some traditional treatment methods have been proven to be effective to some extent, but the side effects are also apparent. Moreover, for some people, language-based traditional psychological therapy may be difficult or insufficient. Since the 20th century, music therapy has been proven to be an effective treatment method, widely used in the treatment of physical and mental illnesses. Furthermore, music therapy has not been found to have any significant side effect as a treatment method. Currently, some studies have evaluated the impact of music therapy on depression, and it has been proven effective in reducing anxiety and depression levels. However, there is still a lack of research evaluating the effectiveness of different music therapy methods for depression and how to choose different methods based on the different symptoms of depression. This study will analyze and summarize the existing experimental research of music therapy in depression treatment and summarize the role and effectiveness of 4 main music therapy methods in depression treatment. The third part is research content. I will briefly introduce some terms I use in the paper and my research method. Depression is a common but serious mental illness that can have negative effects on human emotions, thinking patterns, and behavior. Common treatments for depression include medication, psychotherapy, and electroconvulsive therapy. Both medication and ECT are accompanied by side effects. In addition, some patients may not respond well to the traditional language-based psychotherapy. The music therapy method. Music therapy refers to the planned use of music by therapists to achieve therapeutic effects. Gracia differentiated music therapy approaches according to the way of interaction into 4 main categories in his a 1998 book. They are improvisation, creative, recreative, and receptive. In this content, receptive is a passive method, while the improvisation, creative, recreation are active methods. The receptive method is a passive way of interacting between the clinics and music, where the clinics listen to the music and respond to the expresses in a nonverbal or verbal or other ways, such as art or dancing. And the music used can be live or recorded. Improvisation is a process in which visitors and therapists create music together in the moment to express visitors' current emotions. Improvisation can be involved singing or playing simple instruments to create improvised melodies, rhythm, sounds, or instrumental pieces. Creative is a method in which music therapists support clinics in the process of creating their own music or lyrics. This music work is then recorded, preserved as sheet music, handwritten or types, or recorded onto CDs, tapes, or MP3s. In the method of recreative, clinics learn, sing, play, or perform pre-created music or reproduce any form of music. It is broader than the concept of performing, like including rendering, producing, realizing, or interpreting any parts of other existing musical works. The research method has 3 steps. First, 4 research papers using passive method in the treatment for depression were analyzed. Second, 5 research papers using active methods in the treatment of depression were analyzed. And finally, we compared the use of passive method and active method. So the fourth part is my research results. There are 4 research papers using the passive method of music therapy. All 4 papers showed a significant improvement in depression symptoms with passive music therapy methods. 2 papers showed that passive music therapy methods were more effective in treating depression than traditional psychotherapy. In the analysis of the results, Castillo concludes that listening to classical music stimulates positive emotions and lowers the depression levels. Dashmak results showed that passive music therapy significantly improved the sleeping quality. And there are 5 papers using the active music therapy methods, 3 of them using the improvisational music therapy, and one of these specially used the emotion regulation improvisation music therapy. And the method used in Silverman's 2021 papers was classified as creative music therapy, and the method used in Fancourt's 2016 paper was classified as recreative music therapy. From the results, 4 out of 5 articles concluded that the active music therapy have a significant effect on improving depression. In Silverman's article, although active music therapy did not have a significant effect on improving depression compared to the traditional method, participants in music therapy group reported more enjoyment and positive cognitive changes compared to the control group in the post-test and follow-up. And in the analysis of the results, each article has its own way to interpretation and complexity. Alborno's report found that, compared to the traditional psychological treatment, participants using active music therapy showed significantly improvement in anxiety and physical pain. And Albel's article shows that in improvisation, slow rhythms lead to lower emotion states, while faster rhythms may invoke higher emotion states. In the use of creative music therapy, the perception of help, enjoyment, and comfort was significantly higher than that of the traditional language therapy conditions. In the use of recreative music therapy, participants' social resilience improves, and the anxiety and mental health also improves. For the comparison, the passive music therapy is mainly effective on improving patient sleep and stimulating beneficial emotions in the treatment of depression. In the contrast, active music therapy improves symptoms of depression in various ways. The effects of active music therapy are mainly reflected in alleviating the physical pain, increasing positive emotions, relieving anxiety, and improving social interaction skills. Active music therapy requires more language and physical response from the patient than the passive music therapy, which makes them pay more attention to the music, and thus the music has a greater impact on them. Playing an instrument requires purposeful physical movement, while music production is social, pleasant, and meaningful. In addition, a study on active and passive group music therapy in the treatment of depression shows that the receptive therapy group may reach the peak of the therapeutic effect more quickly, but the active therapy group may have a higher peak effect. And here is my conclusion. So overall, this paper discussed the application, effectiveness, and effects of different music therapy methods in the treatment of depression. Based on analyzing and summary of existing experimental research paper, active music therapy methods compared to passive music therapy methods improve more symptoms of depression in more aspects. The passive music therapy is mainly effective in improving patient sleep and stimulating beneficial emotions in the treatment of depression. The effect of active music therapy method mainly includes improving physical pain, increasing positive emotions, relieving anxiety, and increased social interaction ability. The receptive treatment group reached the peak treatment effect faster, but the active treatment group had a higher peak effect. This paper also has certain limitations. In this article, participants' information was not further summarized and analyzed, and the number of literature included in this article is relatively small. And in the future, more research is needed. The research direction of the literature review can include summarizing whether different music therapy methods are more suitable for participants of different ages and genders, and the music therapy experimental research hopes to pay more attention to the influence of different subdivision methods of music therapy on the treatment of depression. And here is my reference list, and my similarity index is 16%. Thank you so much for listening.